You are watching Access LaPorte County Channel 97. Coming up next is the October 21st meeting for the LaPorte County Board of Health. You can find more information for this meeting by visiting www.accesslaportecounty.org.
All right. I'd like to call this meeting to order of the LaPorte County Board of Health, our quarterly meeting. It is 4:05 p.m. Let's start with roll call.
Mrs. Arnold? Present. Dr. Nelson?
Present.
Ms. Lawn?
Here.
Dr. Manning Cox?
Here.
Dr. Pinks?
Here.
Dr. Uhas? I believe she'll be joining us in a little bit. We have a quorum.
Wonderful. Next, approval of the minutes. Has everybody had a chance to read the very long minutes? Does anybody want to make a motion to approve the minutes? Make any amendments to the minutes?
I move to approve the minutes of July 15th, 2025.
Who would like to second that? Fantastic. Dr. Manning Cox. Nobody's called in, so we can just do a voice yay or nay, correct? All right, very good. Everybody who would like to approve the minutes, please say yay.
Yay.
And anyone declining, nay? Everybody? Nope. Anybody abstaining? No.
I'm abstaining since I
You're-
wasn't here.
Oh,
I always
fantastic.
feel funny approving minutes if I wasn't
weren't
here.
there.
How would I know to do that?
Very,
You're supposed to read them when she.
I did read them, but I mean, they could be total falsehoods.
yeah. Yeah, it's all kinds of stuff in there.
Exactly. So,
When I read them, I went, wow, I was on fire that day. All right. All right. Minutes approved. Next, public comment. Public comment? We have a couple people in public? No? All right. Going once? Going twice? All right. Reports and discussions. The health officer's report. Dr. Ducey.
Okay, the health officer forgot her report at home, and so I'm going to wing it too, as can be. Is that I'm sorry I wasn't here the last visit, or last meeting, but I was out of town. The major issues that I was going to address, and one of the reasons I hadn't sent in a report, is that with the CDC closed and with all the changes that were coming at the time that the report was to be in, I decided to talk about it instead. Obviously, some of the major issues are the changes in the vaccine suggestions. MMRV is now going to be divided up. There is some limited evidence that the vaccine, the varicella, can cause problems, and there's concerns about that, because the fact is they're talking about putting it off to 3 or 4, and of course these kids are exposed by that time. They've got brothers, sisters, and they're out in that. So obviously I certainly have some concerns about that, but that is the way that it is right now. The other issues that they were talking about, of course, was flu and COVID. Flu shot was generally still recommended for the usual people that would get it. COVID, again, now that's changed, is that 65 and over, it's recommended, as it always has been. But beyond that, anybody who has under that, with any kind of pre-existing condition, can probably get it. For a while there, they were having to be told, they were going to pharmacies, or I'm sure probably public health, or wherever they could, were told they had to get a prescription from their doctor, which was never true. But so that probably deterred a few people, because it's bad enough to have to go out and pay for your COVID shot and make appointments and that kind of thing, is that they also just couldn't get them. So now they are available, but not always easily, as we don't have our COVID shot up and running yet. So hopefully everybody will continue to get it. Unfortunately, with a whole lot of different reasons, which I'm going to talk about in a minute, there's been a lot of vaccine hesitancy in the last little while, and unfortunately, the COVID shot rate is way down, and flu shot is down, and also the measles shot is down, and measles are up. We now have measles in Lake County, just one so far, but it's Lake County, which is awfully close to home. So, and that was just reported a couple days ago. So I'm obviously concerned about that. And again, I had all my numbers, so you're going to have to bear with me for a moment. I will send in a report if needed. But for the measles right now, in 20,000 Hi. In 20,000, we were the first and only country to declare measles eradicated. It is now, we're just on the verge of losing that distinction. Is that because of the numbers of cases that have gone, the lack of immunizations, the number of, not just the cases, but the fact that they're clustered to show that there is issues. I had, again, some very nice numbers, but the bottom line is the, it's the below 5-year-olds that are the worst. They're 70-80% of all the cases. And again, bear with me with my numbers, but they're the most. And then obviously, there are certainly other numbers that all go down. Hospitalizations are primarily in the 0 to 5-year-olds.
I'll stop for a minute.
So obviously it's a risk. There have been some deaths with measles, and of course the big thing is that they're not getting vaccinated. And I'm going to talk a little bit about vaccines in a minute. So that's something else that obviously is of concern. You know, the major thing that also I was going to mention through all this is, why is this happening? And I think in some ways we don't really know, but one of the things that not me, people way smarter than me have come up with is talking about how to address this vaccine hesitancy. And I'm sure some of you may have seen this or not. It's called the 3 C's: complacency, confidence, and convenience. And as vaccine providers, it's important that we follow those types of things, which I think we all here do as much as we possibly can. But in a lot of places, they aren't advertising that there's vaccines available. There's not the information that's out to help provide it. So the complacency comes from the fact that people think, I don't know anybody with measles. Have you ever seen anybody with measles? Any of your kids got measles? There's just this feeling that it's gone away. It's not dangerous. It's not going to affect me. It's not going to affect my family. And the whole country, to a certain extent, has become complacent with many things, but we're talking specifically about vaccines. And that's really concerning, is people just don't think we need them anymore. We didn't die in COVID, so we're not going to die now. And because most of us didn't die in COVID because we had our vaccines. And pardon?
I think pretty much all of us did.
Wow, yeah, I meant most of us that are alive. Most of us still alive from it. Certainly, I was practicing during COVID, and the only people that I lost were ones that refused to be vaccinated. Some at the beginning before the vaccine, and that's something, but anybody after that, it was a refusal of vaccines. The other thing that, let me get myself straight here again. The next C is confidence. And right now there is a lot of information out there to destroy people's confidences in the vaccines. And again, I don't want to make this political, and I'm not going to, but again, if you're hearing from people in high power that you shouldn't get this, you shouldn't do this is the risk, this isn't important, people are listening. Nobody wants a shot. And if somebody tells me I don't have to get one, I'm going to go, okay, and until it's your kid that's in hospital and ICU with measles, or you're back in the ICU because you've got COVID. But people just think nobody else seems to care, so why should I? Or people in power don't seem to, and that's the third thing. And the third thing is convenience. Can't come here to get a COVID shot right now. Then that's not our fault. That's all the issues that are going down. But it's very difficult for people, especially the ones that were being told, if you want COVID, even though they absolutely should have it. They got a history of a cancer, a history of this, or whatever would make them under 65 and require COVID. They were being told you have to go and get a prescription from a doctor before you can get it done. That's not true. But that's what was out there. And people who will go get their shots because somebody in their family's died, this and that, can't necessarily afford to go get their shot and then having go to a doctor first to get a prescription. That has hopefully been completely debunked at this point, and people do not need a prescription to get their COVID shots. I think it's the whole thing with this is measles is going up. COVID is not going way up yet, we think. But there's nobody measuring it. In some of the countries, some of the states, the wastewater is still being manned, and that is, the numbers are going up in the signs of COVID, in the wastewater is up in a number of places, but we don't really have anybody counting numbers, so it's very difficult to know whether there is any increase or not. I mean, we obviously know measles is hugely going up, and again, the numbers aren't huge. We're not talking 1 million people, but we're sure talking about a lot of young kids that are suffering and potentially dying because of the lack of immunizations. That's my rant.
My question about the measles in Lake County is that, sorry. Questions about measles in Lake County was, do we know if that's a student or is that somebody was out of the area? Do we know anything about?
Child, all I've just seen this. I didn't get a notification about it. I just saw it on the news, and it is a young child, unvaccinated. That's all I'm aware of.
Do we
But
have
local, local to Lake.
Do we have a percentage of people of under 18-year-olds that are not vaccinated in LaPorte County, or do we not know because those that are not vaccinated, chances are homeschooled or?
Yeah, I couldn't tell you that,
No idea.
actually. What it had been sort of nationally is about 96% of kids in 2000 were, or I'm sorry, not 2000, before COVID, were vaccinated. And now the numbers are down just about 92%, I believe. Like I said, I'm sorry, I forgot my exact numbers, but those are pretty good. And a 4% drop, that involves millions of kids, or thousands and thousands, if not millions. So it's important.
My other question was about the wastewater testing of that's not
do-
done
they-
in Indiana, is it? The wastewater testing of,
There have been some,
okay.
I was going to say, some of the
there
big.
have been some that have been participating in that, and the city of LaPorte it was BioBot that was doing a lot of it.
Okay.
A lot of it was grant-based. So who's still participating, I'm not 100% sure.
Okay.
Most of the ones that I did see were in the East, New York, New Jersey, those kinds of places that I was seeing the information about. And again, I'm sorry, I didn't remember exactly all the states that were still doing it.
Anybody else have questions?
I wanted to ask about the RSV. I know, well, my husband was insistent upon me getting the RSV.
As he should.
And of course I got it. But as much as I try to talk around the area, since I belong to a number of organizations, and I always volunteer, it's not only COVID and flu, but there's RSV for those who are over, what is that, 65. And people tell me, well, nobody's talking about it. We talked about the authorities, and so maybe we don't have to have it anymore.
Well, again, that's exactly what I'm saying, is that it's unfortunately, there is not a push into the public right now that's believable, I guess, in lots of people's minds, that to let people know about this. I mean, these are life-saving vaccinations. The kids are dying, people are dying, think of that. And somehow it's just become, I don't know anybody who died of it, so I must not need it. Well, it doesn't work that way. And yes, he should have made you get your RSV. Everybody at our tender ages should be getting RSV.
Yes, the tender ages. Well, maybe that's something that maybe we can do. Is that against the law for us to mention it when we're out in different, say, even in the political sphere? I mention it when there are gathering of people. I talk about health issues.
Well, that's the point of why I'm talking about this, because I'm not sure all of us are talking about it enough to our friends, to our families. I don't know who watches these shows on TV, but if any of you are, spread it to your friends and family. This is personal. It's not somebody in Texas with measles. It's somebody in the state or the county over from us. And I gotta tell you, I have to drive through there to get to the airport tomorrow. I'm going to hold my breath. And again, that's a bit simplistic. But the bottom line is we all, in particular as health board members, as employees, we all need to be, championing. Thank you. It was coming into my tongue. Championing vaccines and letting people know how important it is. It just in everyday dinner party conversations and things like that, because it has become politicized. And I'm not going down that path, but because it has become politicized, a lot of people are afraid to talk about this or that because they don't want to be seen as being on this side or the other side. And vaccines and other kinds of treatments have become part of that conversation, or a conversation that's not being held by people.
With respect to RSV, there's a very effective TV ad right now for RSV, very well done.
Yeah.
And the background is like a party. You hear the noise, the music, people talking. And you're probably in another room doing something and not even paying attention. And then all of a sudden, the screen goes black and it's silent. And I'm like, did we lose the signal? And then comes the gray lettering that RSV, affects adults over 65, underlying conditions are listed, and it really grabs your attention. So somebody is promoting the vaccine for RSV, but if we're not doing it locally, it's not enough.
Everything, but not the way they should.
So that's all. So if we have some kind of initiative here in town where we talk it up, that's a good idea, Dr. Cox. Very good. But that ad, keep an eye out
I've seen
for
it.
it.
Yeah, it really is good. So
It's impressive.
yeah.
Scary.
Yeah.
It's the shingles one too. I mean, shingles is a little bit different type of. There's not the community spread, but people. Oh, I don't need shingles. I've never known anybody with shingles until you do know somebody with shingles, or you get it yourself, and then you're going to wish. I mean, unfortunately, it's too late at that point if you're the one suffering from it, and it's a miserable disease.
And you'll never
That's
forget it.
preventable.
Yeah, I was just under the age of the, vaccine when they even offer it. And I got shingles out of the blue, and it was in my lung. And it felt like every breath I took felt like I was breathing in lava.
Yeah. Oh, but so many people saying, "Oh, I don't need that," or I'm not that active. I don't go out that much. And that for shingles, it has nothing to do with whether you're in or whether you're out. It's whether you had chicken pox.
Yeah, so I've just been beating over all friends' heads
Yep.
to get the shingle shot until they're tired of listening to me.
That's what I want all of us to be doing, is that if somehow a conversation goes that direction, push it a little farther if you possibly can.
I have to hand it to CVS here in Long Beach. I went in to get my COVID booster, and I said, do you have COVID booster in stock? I don't, And she goes, yeah, and would you like? And they offered me 4 vaccines. And I said, yes. RSV, flu, COVID, and I forget what the 4th one was, rabies. But
Yeah.
I took that one. But I was really impressed that I didn't have to fish for it. They were proactive. They offered it, and I survived. Both arms, they split it 2 and 2. Cleo got it, and I'm a little tired the next day and was a little sore, but no drastic side effects. So I could vouch that I'm here and alive and kicking.
All right. Anybody else have any other questions for Dr. Ducey, the health officer?
I don't have a question, but I have a public service announcement. My nephew passed away from COVID. He was 54, was very healthy, but didn't believe in the injection. He died. So I do it in memory of him.
Wonderful. Wonderful.
Yes.
We're sorry.
And spread the word.
Yeah.
All right. Would someone like to make a motion to accept the health officer's report as given?
So move.
Second.
All right, Dr. Cox, you seconded that? I'm not certain who did first or second.
Dr. Cox first, Dr. Nelson.
All right, Dr. Nelson was second. All right, next is the administrator's report. Administrator Lanners?
And I will be getting my shingle shot this week. Because I keep putting it off, and now it's like, nope, got to do it. It's never a good time.
It does
Don't let
hurt.
me
I'm not going to
forget.
say that. That one can hurt your arm, but shingles is worse.
Pardon?
She was asking if you needed to move your mic closer, but as long as the powers that be can hear you.
Can you hear me now?
Better.
You can hear me better? Okay. You need to move to the end. Third quarter, again, is always busy. I say that every year, but it is the busiest quarter of the year as far as, at least in the food department. Trisha touched on the fair already at our last meeting. But again, those festivals, it seems like every year there's more and more and more. And we're getting through it, but it's getting more and more challenging each year as those festivals added on, and it adds on to the weekend work. So we may have to look at trying to find another part-time person. At one time, we had a part-time person for seasonal work to do food inspections, and next year, I believe I'm going to have to try and offer that again, just so everybody's not getting burnt out. And it used to be one person used to be able to do the weekend work, and now we need 2 or 3 inspectors out there so they don't get that break in between. I put a chart on there so you could see the number of mosquitoes that are being trapped during the summer. We do that every year. Our interns, that's one of their job duties, is setting up the mosquito traps. We are now doing gravid traps instead of light traps. It's a little bit more specific to the type of mosquito that we want to catch, and also getting more of the females and not everybody, because that's what we want to test, are the females, are the ones that are going to be transmitting and taking the blood meal. So 154,890 mosquitoes is what was tested at the state laboratory. 2,346 pools. So instead of testing a single mosquito, which you can't do, what was in the trap, they can test up to 50 mosquitoes and put it in and test at one time. So that's why there was 2,300 tests and not 154,000 tests that were done. West Nile virus was found throughout the state. Every single county was positive. And it has been for very many years, and it will continue to be. We're never not going to not see West Nile positive pools again. But they still continue to monitor. There are other arboviruses that are tested at the same time, and you can see that EEE was tested and is tested every year. That one is very much, I don't know how I want to, is very much a high death rate with that. So if you're going to get that, there's a very high mortality, and chances of recovery are extremely low for human cases. There were cases positive, but in a single case of a horse. And when you start seeing animal cases, you start watching that surveillance very hard. Usually, at least I know for West Nile virus, it's 6 to 8 weeks out where you can expect to start seeing human cases. I'm not sure. I think it's probably about the same for EEE. I don't know if you know, Dr. Pinks. You might not know. You know the horse side.
Yeah, and you're talking about the equine encephalitis. Is
Eastern
EEE,
equine encephalitis.
Yes, but wasn't there somebody in 2024 that died just across the border in either Three Oaks or Union Pier?
Yep, more than likely.
It was a mortality of a gentleman who lived, I believe, with horses.
Pretty much every year in Michigan.
Mm-hmm.
Yeah.
Okay.
Again, the type of mosquito is looking for a very specific habitat, which we're that very northern, bog area. It has to have acidic water, and we see a lot more of that habitat in Michigan. But yeah, unfortunately, I don't know if you remember, several years ago we had a case of a horse, and we had, that was COVID year. It was 2021. It was like every month it was something different that we got hit with, and that was a bad year. Oh, wipe it from my brain.
Well, speaking of vaccines, animals metabolize things differently. I think the equine encephalitis vaccine for horses has to be given every 6 months. Is that right, Dr. Pinks?
I believe so.
Yeah. All right. Is that all?
On mosquitoes, and I can talk about that all day, but we won't go there. Our Heart Safe program is up and running and is doing amazing. We got a grant from the Health Care Foundation of LaPorte to start the Health Safe program. City of Michigan City is a Heart Safe designated community, and we wanted to take that program countywide. So it's a big undertaking to be part of that program. One of the things is getting 15% of the population trained in CPR. So it's a matter of working with each community to make that happen. So Alicia Bishop was hired. She started just after the 4th of July, the 5th or 6th of July, and has just taken that program and is running with it. One of the part of that program is cataloging and updating all of the AEDs in the county. The program that the county is using as purchased is called Pulse Point, and it's available as an app. And when you bring it up, you don't have to register or anything, just download it. It figures out where you're at. And just sitting here in the office, it's showing that there's 37 AEDs that are located nearby. And you can click on an area, it'll show you, it'll show you if it's the building's open or closed. Is it 24/7? It shows a picture of where the AED is located in the building. But that has to be verified every year. So that's one of the things Alicia has been doing, is going out to these facilities to A, make sure they still have an AED. B, does it have the battery and pads, and are they not expired? And to take a picture and upload it into the Pulse Point program. We had 430 when she started, and we're up to 595 in the registry. So it's one of those things that snowballs when you go someplace. Yes, we have an AED, here it is. Oh, by the way, we have 5 more. So it's getting all of those. So the whole idea behind Pulse Point, and if you have it downloaded on your phone, and you're in an emergency situation where somebody needs an AED, you can open that up and it can tell you where it's at. There's a response time there with 911. They're not going to necessarily get to you within 3 minutes. If you can have an AED within 3 minutes, it drastically increases the survivability of a heart attack. So it is encouraging the public to take action and not to have that fear, and to be able to get somebody that help sooner. So we launched our website. You can visit it at heartsafelpc.org. It'll give you more information about the program and what we are doing and the steps, all the steps that are included to becoming a heart safe community. We have reached 25% of our goal of getting 15% of the county trained in CPR and AED. When I wrote the report, she only had 531, and as of Friday, she had 595. We have a campaign going on right now, also until the end of the year. You can see it on our Facebook page, and we're getting a lot of hits on it, so that's very encouraging to see. Excuse me. And Alicia and I will be attending the Citizen CPR Foundation biannual conference this year in December. So I think it worked out to be just perfect timing as we're beginning this program to be able to meet with other people from around the country who have been able to do this in their communities, and what we can learn from them to make it work better here for us. And it's a big undertaking. There's not very many counties. There's a lot of cities throughout the country, but there are not very many that are countywide programs. So it'll be a small grouping, an elite club, if it were, as to say. Another thing that's been going very well for us is our birth and death certificates. You can now request for and pay for online. Just in the month of September, we filled 143 birth certificate requests and 27 death requests. Most of these people who are requesting it are out of state, so they wouldn't necessarily be able to, and I know that probably a lot of it is because of the ID, the true ID, that you have to have a birth certificate to get. So everybody who's moved out of state they can't find it, or it was the one you get when you come home from the hospital, so they don't have a real one. So that's going very, very well. It's a very easy program to use. There were some bugs that we had to work out of it, but I think it's working very, very well. Same thing with the death. The big one I was very surprised to see just for the month of September were 87 temporary food vendor requests and payments. That's crazy. Yeah. Which is good, just to show you how busy that we are, even still into the month of September with temporary food vendor requests on the weekends. But they don't have to come into the office anymore. If they get on at the very last minute or they forgot to pay, they can now go online and do that payment instead of having to run up to the office to do it last minute or not being able to set up at all because they don't have a permit. And we still do offer the vital check to do birth and death certificate if you need to have a birth or death certificate right away. What we're just doing regular mail for our birth and death certificates, and we don't charge extra to have those mailed out. But if you need to have it overnight or in the next day or two, they can still do vital check, but that's a little salty. It's $40, $50 to get a birth certificate. Otherwise, it's $15.49. So that's worked out very well for us. And along with that, with the same company, is allowing us to take credit cards in the office, which is going to be great here pretty soon with our food permits that are coming up, because those are usually very large transactions. And previously, it was either had to be cash or a check. Sometimes you always worry about somebody walking in and pulling out a giant wad of cash. You're like, We were having a problem with our card swipers. They just sent us new machines, and we're now going to have the tap to pay, so we don't even have to worry about swiping the card. That's hopefully will take care of that very last bug. But we are offering that for all of our services. And finally, October is Safe Sleep Month. I know that's out of the quarter, but it's October, so I'll talk about it. We did a we did a video. When I say we, I mean Dr. Ducey did a video for Safe Sleep Month. And it was the District 1 health departments that participated. So Lake Porter, LaPorte, Pulaski participated. Newton did not. City of Gary, City of East Chicago. The video is posted to our Facebook page, and it does talk about the safe sleep and all of the administrators and staffing. It's done very, very well. There has been an uptick in unsafe sleeps. Within the last month or so, there's been 18, which is a huge increase, so we're not quite sure what happened there. We still do offer a program where you can get a crib for free, or not a crib, but a pack and play, to be able to have your child for a safe place to sleep and not to co-sleep.
Can I just make one comment that I saw too, is that there's a whole a number of these are when the babies are away from home because they aren't sleeping where they were. And there was some comment that some of this is because, again, more people are not necessarily homeless but not where they would normally be to have a nice crib and a nice bed for that. And that they were talking this was more, I must admit, about Chicago at this point, but it was the same idea, is that if you don't have your nice safe crib so you can put your baby down there and you've got the baby and 3 other kids all in one bed, there has been an uptick, and that's one of the things that they have been talking about as potentially adding to it.
There's, I know that there's a nationwide service, but they service locally in LaPorte, Michigan City, called Baby Quip. So, like, let's say you were coming from out of town, you're staying at an Airbnb that doesn't provide a pack and play because, one, it's very hard to sanitize those. I can see why someone wouldn't want to take on that responsibility. I wouldn't know how to clean one properly, right? right? But there's something called Baby Quip where people can rent cribs, pack and plays, strollers, all kinds of stuff, and they do it locally where they deliver it to whatever home or hotel you're staying in. I thought that was fascinating that even a town is, I could see in Chicago, New York, and so I looked it up and saw, LaPorte, Michigan City also participates in that rental.
I've seen the ads for
So, I
it.
mean, at least it's out there.
Right.
People just don't know.
I think a lot of it is the fact that people are being out of their homes and having to go in with relatives, and some of them are into homeless shelters, that type of thing, with babies, and there just isn't always the facilities for that.
But there's a number of organizations throughout LaPorte County that offer the pack and plays. And it's not just for the parents, it's for anybody who's going to be caring for the child. They're eligible to come and get one of those. They just have to go through a small, short class for all liability reasons, and then they can have the pack and play. So, and that's all I have for you. If there's any questions,
Where's the nearest AED from where we
out
are right
that
now?
front door.
That front door. So
Yeah, right
So
next
we
to
all
the
know.
bathroom.
My other question was about who needs a temporary food service vendor request? I mean, what kind of business, or would that be like a church fish fry on a Friday? Who would require a temporary application?
Somebody like a church, they're actually able to serve food. Nonprofits are able to serve food 15 times a year without getting a permit. So it's that 16th time that would trigger. Or it's somebody who, like a restaurant, and they want to go do Scarecrow Fest, and they don't have a food truck. So anytime you're setting up off-site or you're setting up in a tent, that would require you to have a temporary food permit. That requires you to have an inspection as well. Food trucks can get a permit if they're going to operate in the county more than a couple times a year. It's more cost effective to do the food permit, and they can set up anywhere then without being inspected. They have their regular inspections. But anytime you're setting up in a tent, you're going to get it. That's going to cause a food permit. Or even if it's at not necessarily a tent, it could be in a building at a craft fair, for instance. Gosh, the thing where you go buy the stuff and there's things there, right? That place. Yeah. So that's what would cause a temporary.
That place.
Anyone else have any questions for
Yes,
Administrator
Doctor.
Lanners?
Oh, just for information, they, as far as training for CPR, do they also have it equipped in order to provide training for the BLS?
That is going to depend on who's doing the training. So on our website, the HeartSafe LPC, it does list all of the trainings that are in the area and what specifically is happening at each of those trainings.
Okay. And the reason why I just asked was because when I had renewed my license 2 years ago, it was very difficult trying to find someone who did the BLS. And it's that time again, so I was just wondering, where can I go and get that?
Yeah. I was trying to think, we have several that are listed on there. We're trying to be the one-stop shop for all of those type of trainings and encouraging everybody to use that. But I don't remember, not in the next couple of months, I don't think there is. At least I don't remember with the BLS part. I'll ask around though tomorrow and see if I can find one for you.
Okay, because eventually I found someone, but it was in a little house, and it was like a hoarder's house. And but she gave me the training, and I got a legitimate card. But it was just that I just thought that was a little
Odd.
I think when I did mine, I did mine with the South Bend Fire Department. They offered it there, and it had all of the BLS AED. They had an extended training.
LaPorte, number one, did not have. They had it just the CPR, and he was being very nice and trying to help me find something, but it was just difficult.
Dr. Pinks?
I was wondering if there's anything or how businesses could go about getting an AED. Like, is there anything?
So right now, the Healthcare Foundation does have a grant program for AEDs. They offer it once a year, and it opens up on February the 14th. They typically provide about 25 AEDs a year, so everybody's encouraged to go through there to get one. We are trying to find more grant opportunities for people, but AEDs are quite the investment. The ones that we have, they're over $2,000 a piece. So yeah, that was another way trying to find more opportunities for people.
And what month is that it opens up?
It's February the 14th.
Okay, thank you.
Oh, Valentine's Day.
Yeah.
Any other questions for Amanda? Any other questions? Does anyone want to make a motion to accept the director's report, the administrator's report?
I'll make a motion to accept the administrator's report.
I'll second that.
All right. All who would like, and we can do this again by voice. Okay. All who want to approve of these minutes as written and read, please say aye.
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 Anyone decline, say nay. No nays. Anybody want to abstain? No? All right, fantastic. On to the nursing supervisor's report. Jennifer.
Good afternoon.
How are you?
Good, thank you. Just going over, Dr. Ducey talked a lot about what I was going to talk about with vaccines. So I'm just going to breeze over a couple things. We do currently have our high-dose flu vaccine for 65 and older, and we have an ample supply of flu vaccine for people 6 months through 64 years of age as well. The ACIP has affirmed the recommendation that anyone 6 months and older should get the flu vaccine unless there is a contraindication as to not to get it. As Dr. Ducey said, there's been some changes to the COVID-19 vaccine recommendations. We are awaiting our standing orders from the CDC. I'm going to look into that more this week to try and find out, because we have the vaccine, we just cannot administer it because we don't have a standing order. So we will do that this week. I did put a handout in your packet. I just heard about this literally 2 weeks ago. I've never heard of the New World screwworm myiasis before. So I thought that I would hand out a packet, or in my packet, so you can read about it. Apparently there's an outbreak right now in the Mexico and Central America area where it's affected over 720 cases. It's mainly found in animals, but it does have the ability to affect humans. It's a fly that lays its eggs in open wounds or in other body cavities, such as mucous membranes. And it's very destructive. It can destroy crops, or actually not crops, but farm animals. And then it can, like I said, be transmitted to humans. So right now, the situation's being monitored, but there's no immediate risk of infestation to people in the United States. And my numbers for the quarter, we tested 46 clients in our laboratory services clinic. We did 3 safe sleep classes, provided 422 clients, provided 863 immunizations to 422 clients in our immunization clinic. Provided 12 immunizations to 7 clients for international travel, tested 1 child for lead, and followed up on 3 outside lead levels. 4 clients were tested in our confidential services clinic. 81 TB tests were administered, and 91 communicable disease cases were reported. Any questions?
No one has any questions for Nurse Smith? None? Seeing as we have no questions, do we have anybody that would like to make
Make a motion to accept Nurse Smith's
fantastic?
report.
Fantastic. All right. Dr. Uhas and Dr. Pinks, all who would like to accept the nursing supervisor's report, please say aye.
Aye.
Opposed? Anyone abstaining? No. All right, on to the Environmental Health Food Division Service Supervisor's Report.
Hello. Just the numbers for the third quarter. There, I'll do the food first. We had 21 food complaints, 9 new permits issued, 7 new mobile permits issued, which is kind of strange for this time of year, but we have mobile units all the time. Just to explain, you had the question earlier about the temporary versus the mobile permits. Just because they're in a truck or a trailer doesn't mean they have a mobile permit that they can operate year round. If they come into the county, they have to be a temporary permit. That's where all those come from. So the 52 permits that were issued during the fair, only 3 of those are mobile. All the rest of those are temporary permits because they don't meet the mobile guideline that we have set up. So all of those are temporary. So when she's talking about applying online for those temporary permits, that has been a huge, huge thing for us because now we can get them all online. They don't have to come in and pay for it. It's really helped us out a lot because we have a lot of checks that bounce through the auditor's office from those people, and now we don't have that. Because now they can all put it on a credit card online. We don't have to deal with the bounce checks. So that's very good for us. We had 6 plan reviews that were done, 138 temporary inspections, so 138 temporary permits were issued, and 344 routine inspections that were done in the third quarter. 63 environmental complaints, 41 septic permits, 48 well permits were issued. And the water lab, which has huge numbers this time, E. coli, 565 tests were done. Coliform, 552. Certified nitrite was 26. 91 lead tests, 14 iron, 187 arsenic, 211 nitrate, and 227 pools were sampled. That's all I have. Questions?
Anyone have any questions for Ms. Wozniak?
Why so many arsenic tests?
The arsenic is new.
Pardon?
187 arsenic tests were done, or?
Test for a drinking water well. So that's part of when we updated the property transfer ordinance, it was requested that we add on arsenic to see if that's an issue in the county or not. So that's why.
Is it?
So far it hasn't been. We've had one that was positive. Yeah.
Yep. Thank you.
All right, seeing that the environmental health supervisor's report was given, does anybody want to make a motion to accept?
I do.
Dr. Pinks, who wants to second?
Second.
All right, everybody who'd like to, that agrees, please say aye.
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 Anybody opposed? Anybody abstaining? All right, on to the attorney's report. Attorney Nuremberg.
Good afternoon. Okay, so we had 2 issues this quarter. One of them actually probably extended from last quarter. Only one of them necessitated the litigation be filed. We had the hearing. It went really well. The defendant has been working really closely with us. It pertains to some raw sewage outside of her control. The court was very helpful in getting that resolved. We worked with the building commissioner, and we postponed the hearing, pushed that back because it sounds like everything's clearing itself up. So that went really well. Knock on wood. Always optimistic when people will work with us, right? The other case was allegedly a rodent emergency infestation. Amanda was very proactive and got the state involved, and there seems to be no evidence of that. As things sit right now, we're working on doing another inspection, a follow-up inspection, but so far things look like they've remedied themselves, or maybe the issue wasn't as severe as we had originally thought. That has not launched into litigation as of yet. So we're going to have to see what happens when the department does its follow-up inspection. The building commission has been very helpful in that matter as well. So that seems to be, again, knock on wood, hopefully that too is coming to an end, unless we get any other reports. But as of right now, we're not moving forward with the emergency declaration, so we'll see what happens. But everything is falling into place nicely. And again, it's been very helpful to have the building commission work with us on that. So to my knowledge, again, I always tend to be a little bit optimistic, but so far we're moving right along through both of those. So.
An optimistic attorney, refreshing.
Yeah, I don't fit the mold.
I have a question. What deems a rodent infestation emergency? What causes that kind of what is that?
Yeah, we need a precise definition for that, frankly. That is part of the problem. And just because we get reports on it, I mean, we have to substantiate these claims, right? So it's not just because somebody complains that they saw some. We really need evidence of that before we can move forward. Otherwise, we aren't proving our case. So we don't want to be too trigger happy with these types of things. Now, this issue had been going on for a while, and then we heard nothing about it, so we just assumed no news is good news. And then it kind of got stoked again, and then we did the I had nothing to do with it. The health department did an inspection, and that came back that there was no evidence of the number of rats that they had been concerned about. And it doesn't help in this situation. The house was vacant for a long time, so these types of things happen if there's not a lot of maintenance going on, or if you're feeding animals in the area, or when you're next to a farmland, right? These animals are going to be present, so we have to isolate it to that specific property. I hope I answered that question. Did I answer that question? Okay.
And sometimes it's obvious. If you remember a couple years ago, we had an issue with the local grocery store that we went in and you're like, without a doubt, if you're seeing signs in the middle of the day, or signs period inside the store, that's a problem. So that had to take emergency action. And at that time, the facility had to close down for 24 hours. And so yeah, it's all case by case. Is there somebody living there? Is there nobody living there? Is there food involved? Is it a restaurant? So there's a
that's
curve
a very
there.
Good point that Amanda just made. It is very fact specific. These matters have to be, right? Is the public involved? Is this impacting their health? All these things.
All right. Would anyone like to make a motion to accept the attorney's report?
Moved.
Dr. Nelson and
Second.
Dr. Uhas seconded that. And accepting, please say yes. Yay, I'm sorry.
Yay.
Yay.
Declining, nay. Abstaining, no one abstaining. All right, on to new business. I see we have something listed under new business, late fee assessments for annual food permit payments.
Yes. I handed out to everybody this very neon yellow paper. This is the letter that we sent out last year with our food permits. They get this letter every single year with the pertinent information for the upcoming permitted year. So this was for the 2025. And on the chart, you can see what their fees are, depending on what type of facility they are. They're broken up as A, B, C, D, and that just depends on what they're serving and how many times a year they get inspected and what their late fees are. So currently how the ordinance is written, there is a 50% late fee per day, and it just compounds for up to a week. And then after a week, if they haven't paid, the facility gets closed, and then they have to pay those fees before they can reopen. With our new fees, that we updated last year. You remember we had a new fee ordinance that went into place. We felt that those fees get a little out of hand. If you see for a D food permit, that would be $325. By the end of the week is $1,300. So we were wondering if the board would consider lowering that late fee to either a flat rate or a flat rate a day.
Personally, I think having something every day encourages someone, and if you just did one late, if you're one day late, it's $100. If it was going to be the same at day 6, I would probably wait to day 6 to do anything.
Right.
Just knowing myself.
Point.
But so
Me
having a
too.
little bit every day, but it does seem like, going from $325 to $1,300, it's so punitive. It really goes against business
Yes.
for an oversight. So I don't know what kind of numbers that we're looking at, but what if we just did a flat, from 325 to 425 to every day for 6 days, adding $100? I mean, I think that's pretty significant. I mean, that's
still a
still seems
significant
high.
after 7 days, that's $700. So that still puts them at $1,000 for a permit.
I just don't know what it was. I don't remember what our permit was before, because now that it's 325, I know that it had gone up, but I didn't
think
know
it
if that was more.
216.
Okay,
Yeah.
so that's
Yeah,
more
so
in
we
line
went to
with that.
Yes.
So does somebody else have a different idea of what to suggest? Do we need to make a motion, or is this something that we just suggest? What are we looking for?
We're just
today?
looking for, we had discussed it and we thought maybe $100 flat fee again if they pay on day 1 or day 6, as long as it's still paid within that week, we felt was fair. Again, it's typically not, we issue over 600 food permits in the year, and it really is not a significant amount of people who are late, though it might change since we're lowering when we will have to see. For the most part, we don't have we have to call, we start calling like the 3rd week of December going, hey, don't forget, this is coming up, and a lot of people appreciate that, but sometimes there's always going to be somebody that's going to be late, but things happen. We understand that things happen.
Does this work the way it is?
No. We're still always going to have that
That was the gist of the whole thing.
microphone.
Sorry.
When we
Decided to do this and go that route and put it so high, we thought it would cut back on the people that would pay late and track them all down, but it doesn't. It doesn't work. It doesn't do anything. It's the same amount of people that pay late no matter what the fee is.
I know it doesn't. And we're not the only county like that has that model. A lot of them do that 50% a day. But it's also when you see that, it's like $1,300. What a bunch of, we don't, it's not
very
a good look
punitive,
for it. Yeah.
Dr. Cox?
Well, I was going to ask that. Have you surveyed other jurisdictions and find out how they do it? Because that does sound punitive.
Right.
And
Because they were having the same problem, so they all went to the same model, and yeah.
yeah, but there,
wanna
but
break
there
the
could be
model.
some other circumstances. Have you ever forgave any part of that
Yes.
because of circumstances that?
I don't know if I do or not.
Yeah.
I do. Yeah, no, we tried it, again, we tried to take it case by case. And yeah, there's been times where we have forgiven that. And it's still like, we can't not charge you a late fee. We're still going to have to charge you some amount of late fee, but we're not going to do the $1,000.
Right.
We don't want to be that way.
Something reasonable. Well, let's go beyond our immediate borders. Maybe there might be some other state that might have a reasonable way of dealing with this.
So regardless, it would still be at day 6, they would lose their license temporarily until all the fees were paid.
Until the fees were paid, because technically at that point, they're operating without a permit.
So I'm going to throw this out there. I'll make a motion that we do it as $100 as a flat fee, but at day 6 and beyond, it's $200. So if at some point in time you have to close them down, because they haven't done it, then it would be the $325 plus $200, correct? For them
Okay.
to reestablish?
We could do that.
Well, that's what I'm throwing out there. Anybody want to second that?
Yeah.
Second.
All right, Dr.
And I just would like to, real quick,
Uh-huh.
we will be updating the food code, which this is in our, not the food code, our ordinance, because the food code has changed. So we're going to have to update our ordinance to match the new state food code. So we can readdress that. We can let you know how this works next quarter. And we can make adjustments to get into the new code.
Okay. So if we pass this motion that's on the table right now, today, would that be in effect today then until another change is made?
It would be in effect for this coming permitting year.
Okay, so 2026?
Yes.
Okay. All right, so there is a motion on the table. The motion on the table was late fee at day one of being $100. It would stay at that same $100 flat fee until day 6, where it would be an additional $100, so $200 plus the initial permit due. And that is a current motion on the table, so we can vote on that or discuss it. Are there any discussions on this? Anybody have any questions since I'm being clear as mud?
Yes. If this doesn't work, can we revisit it?
Absolutely.
Okay.
Yes. I'll report on it at the next meeting.
Okay. I'm not comfortable with it, but
Well, I'm just thinking
We'll
of a
see.
way of trying to save you time also, because every time someone's going to have a problem, they're probably going to come up to you and probably go through 3 different people having to tell their story before they get you that says, okay, let's take it down to just being a flat fee or waive it completely. So it just seems like if everybody's having to do that, it's wasting so many people's time. So that's my thought on it. That's my discussion. Like I said, I don't know what the right answer is, but this isn't working, so I'm just willing to try anything.
it just seems to me we're being lenient for people being responsible for what they're supposed to do.
True. And most of them, yeah. 93% of them are responsible.
Or what?
93% are responsible and do everything according to the date that the permit's due.
But there's a recurrent same number. Is it the same people that,
Normally it is.
is there a reason they're not complying? Is anybody?
Responsibility.
This has to be done by the first of the year, because I can see how around the holidays, you're catering things, you're having parties at your restaurant, you've got your own personal stuff going on for the
Right.
holidays.
Everybody who owns a restaurant knows the invoices go out in October. They're always due by December 31st. That it's been that way for the past 36 years that I've been here. They all know that. They all know they have to renew.
Okay.
But sometimes it is the first time that they're doing it.
Right.
We do have those every year. It's the
Right.
very first time doing it. They're not familiar with the system.
But the handful of people, the probably 20 or less establishments, it's the same ones every year.
What percentage of people actually pay the full fee versus how many people come to you and get
The full late fee?
the full late fee?
There's a couple every year that'll do it.
So they just accept that as like a dummy tax?
Yeah.
Okay. Well, I'm not going to, again, I'm not going to push one way or the other, but there is a motion on the table for $100 and $200 at day 6. So let's vote on that first. Again, I'm not pushing one way or the other. Anybody who would like, this is something that we can do as a voice voting? We don't have to? Okay. Anybody who would like to support $100 and $200 on day 6, please say aye.
Aye.
Anybody opposed? Nay?
Nay.
Anybody abstaining? All right, so we have 1 nay. It does seem like this is going to pass. So as of January the 1st, the new late fees will be at day 1, $100, and at day 6 will be an additional $100 until we have some new information and we get to do this all over again.
And day 7 are closed.
Yeah, at day 7. they would be closed.
That I
So
think is
would
the
be-
big hammer, is
that
day
would be
7
the-
you're closed.
Yeah, that'd be the big hammer for sure.
Something.
Yeah, and you need something.
And of course, because it is money involved, I do have to have the commissioner's approval.
Oh, okay.
So
All upon
This isn't-
commissioner's approval.
commissioner's approval at their next meeting.
So they might put the kibosh on this anyway.
They might put the kibosh on it altogether. We can make the recommendation saying that the board is in favor of it, and we're in favor of it, but it'll be their final decision.
All right. Is there any other new business?
The only new business we can jump to real quick is the 2026 meeting dates. Julie did include a calendar for you in your packet. So our quarterly meetings are in January, April, July, and October. I can't find my, I just
Me
had
neither.
it. Oh, thank you. Thank you for sharing.
Right now, has this time been working out in the afternoon?
4 o'clock is a good time. Usually everybody else has their meetings later in the evening, so this is a good time to have it. We typically have it the third Tuesday of the month, but it could be the second or third Tuesday of the month.
Well, if we were to do it on Tuesday, the 20th, that would be the day after Martin Luther King Day. I just don't know if we should do it the day after what is a 3-day holiday for a lot of people. Any discussion on that?
It's January. We're not going anywhere. It's
We're not
cold.
going anywhere?
Well, why go somewhere, but then,
So
I'm joking. It's whatever.
I
Yeah.
suggest then January the 20th at 4 p.m., same time, same place. And do we automatically go ahead and set those future dates, or we just?
We can do that now, so then it works into everybody has it on their calendar.
Okay.
Does that work for you, Dr. Nelson? Do you know what your on-call schedule will be?
Not have it written down yet.
We
Okay.
can always change those dates, like if we needed to change it for 3 months from now because we realized it was something else.
I do have my call schedule made out for all of 2026, and I can
Okay.
email you back. And finish the
Perfect.
calls out, but let's plan
Yeah.
for Tuesday,
Okay. So the third Tuesday of every,
January, April, July, and October.
I will not be here in
I don't know, do you know when the fair week is offhand? I haven't looked that up yet.
It'll probably be the week of this. I don't know if it'll start on July 4th. It might.
Oh, yeah,
but
we've
that
been
would be
having the
the
fair
week.
really early this year, so,
Yeah.
I mean,
So definitely that first full week.
so it
of
looks
July.
like the third Tuesday of those months are likely days, so
Yes.
does someone want to make a motion that we just set it?
I so move.
All right, anybody want to second her motion to be the
Second.
third Tuesday of each of those 4 months? Dr.
Second.
Pinks is seconding that. Anyone wanting to affirm that, please say aye.
Aye.
Anyone opposed and abstaining? All right. Done with new business, let's go on to old business, which was quite a discussion last month,
It was.
last meeting.
So the commissioners were finally able to vote at this last meeting. And in between our last board meeting and until the commissioners voted, there had been multiple meetings amongst ourselves and also with state officials. So just know that conversation continued up until the very end there. But at the last meeting, the commissioners did vote for us to take a pause on 2026 to see what legislation is going to do in this next session and then reevaluate for 2027. But that does mean we are available to go back to receiving our legacy funding, so we still will receive some money. It'll be about $117,000 that we'll receive. And the state has been informed, and they will let us know next steps soon.
All right, is there any other old business that we need to cover? Oh, Dr. Cox, I'm sorry.
Just a question. Are those same restrictions are in place for that 117,000?
Not all of them, no. Mm-mm. So I can use that. I can get around the other restrictions. Yeah. It still has the hiring freeze on that money, the 30-day hiring freeze and the only servicing Indiana residents. But I can put that into, if we decide to use it towards salaries is really the big, but it's all good. I got a plan.
It's good.
Something, old business, seems like you guys have always been shorthanded, and that hasn't changed at all, correct?
Oh, no, not at all. We're even more shorthanded than last time. Our nursing department is down to 2 nurses and 2 MAs. And one of the nurses is a supervisor, so Jenny. We have the LPN position approved. I do have one application that has come in that we'll probably be interviewing. Hopefully, that's a good fit for us. That's it. I've also just posted more part-time positions, hoping to get a little relief that way. And it's been posted for a week, and within the last week, we haven't had anybody. And I still think it's definitely coming down to a pay. Nurses are very hot commodity. Everybody's competing for them, and we just can't offer what hospitals can offer. So, except for 13 paid holidays a year.
All right, no other old business? All right, shall we accept old business as we have discussed it? I'm not certain if that's something we even have to vote on for old business. Nope, then I think the only other thing is someone needs to make a motion to adjourn the meeting.
I'll move to adjourn.
Who would like to second that motion?
Second.
And I'll say aye, please.
Aye.
Anybody opposed? Then we'll see you in a few months. Thank you very much.